Hello, my name is Stacy Villagran. I'm the Senior Director of Health Insurance Programs at the Nassau-Suffolk Hospital Council. Today, I'm going to discuss enrollment assistance and Medicaid for adults and children, disabled or blind, and anyone over the age of 65. Since 2000, Nassau-Suffolk Hospital Council has provided application enrollment assistance for Medicaid free of charge. We are currently providing assistance to adults and children who are disabled or blind and anyone over the age of 65 in partnership with Suffolk County Department of Social Services throughout Nassau and Suffolk counties. We are currently providing assistance by phone during the COVID pandemic. Enrollment staff complete and sign the application with your permission and send it to the local Department of Social Services for processing. Trained staff at Nassau-Suffolk Hospital Council will assist in completing the Access New York application and the Supplemental A. The Access New York application involves providing information regarding basic information such as household composition and monthly income. The Supplemental A involves providing information regarding resources and the type of Medicaid you will be applying for. Minimal documents are required right now during the COVID pandemic. As always, staff communicate with applicants throughout the process, inform them of any additional information needed by the local district, and they advocate, track, and monitor every application sent to the local Department of Social Services until a determination is made. Medicaid for the aged, blind, and disabled is processed through the Department of Social Services as opposed to the online marketplace that some may already be familiar with. It is a paper application, and it is also referred to as Non MAGI Medicaid. The programs that fall under Non MAGI Medicaid are Community Medicaid, which covers doctors, specialists, and prescriptions; long-term care, which covers home care services and brief hospital stays; chronic care, which covers nursing home or other permanent inpatient setting; Medicaid Excess Income Program, also known as the Spend Down Program; Medicaid Buy-In for working people with disabilities; and Medicaid for adults and children in need of home care and community-based waiver services. Gross income is used for Non MAGI Medicaid to determine eligibility up to 100% of the federal poverty level. Medical premiums are deducted from the income, including Medicare Part B and Part D premiums, private insurance premiums. There is also a resource test. The income level for 2020 for a household size of 1 is $875 per month. The resource level for 2020 is $15,750. For a household size of 2, the income level increases to $1,284, and the resource level increases to $23,100. Community Medicaid coverage includes outpatient, primary care, specialty care, and hospital care; inpatient psychiatric care and substance use disorder rehabilitation with a stay of 29 days or less; prescription drug benefits; and the resource test only involves an attestation of current resources. No documentation is needed. For long-term care services, it includes all services in community coverage, plus adult day health care, limited licensed home care, private duty nursing, hospice in the community, hospice residence program, the assisted living program, consumer-directed personal assistance program, personal emergency response services, managed long-term care in the community, and the home and community-based waiver services. The New York State 2020-2021 budget includes a major change in eligibility for long-term care. Tentative date is 10/1/2020. Applicants will have a 30-month look back similar to applications for nursing homes. If non-exempt transfers are made, the applicant will be subject to a period of ineligibility, also referred to as the penalty period, based on the amount of the transfer. Even though the tentative start date is October 2020, it does not appear that it will happen on that exact date. It may be a little longer for it to come into effect due to circumstances of the pandemic. However, it is worth mentioning since it will take effect sometime during 2021. Chronic care coverage includes coverage for long-term care in a facility, such as a nursing home. Medicaid application for chronic care is completed once a person is placed in a facility and is expected the stay will be longer than 29 days. The resource test is documentation of resources for the past 60 months, 5 years, and it's known as the 5-year look back. Medicaid buy-in for working people with disabilities is a program that allows people with disabilities who are working and earning more than the allowable limits for regular Medicaid, which I mentioned before is 100% of the federal poverty level, to access Medicaid up to 250% of the federal poverty level. This program allows working people with disabilities to earn more income without the risk of losing Medicaid coverage. The income level in 2020 for this program for a household size of 1 is up to $63,492 per year. The resource level for 2020 is $20,000. For a household of 2, the income level goes up to $85,572 with a resource level of $30,000. The amount your income is over the Medicaid level is called excess income or the spend down amount. For this program, Medicaid is not active until an individual has satisfied its spend down amount. And the ways to meet a spend down include providing proof of medical bills to the local district that meet or exceed the monthly spend down each month, pay the monthly spend down each month directly to the local district, or provide proof of medical bills that do not meet the spend down and pay the difference. You can also set up a pooled income trust. A pooled income trust creates a separate account managed by a charitable care organization. The spend down amount is transferred to that separate account every month, and the individual directs the charitable organization managing the account to pay certain allowable expenses with funds in that account. The requirements for a pooled income trust include the individual must be disabled, which includes age-related conditions. Funds in the trust can only be used for the benefit of the Medicaid applicant. Funds can only be used for allowable expenses. And when the Medicaid recipient passes, any remaining funds belong to the charitable care organization. The allowable expenses for a pooled income trust include clothing and food, living expenses such as rent, mortgage, real estate taxes, utilities, travel expenses such as gas and car payments, entertainment, attorney, accountant, guardian fees, supplemental home care services, geriatric care services, and medical procedures not covered by Medicaid. A pooled income trust allows an individual to pay for living expenses and still be eligible for Medicaid benefits. When a person is enrolled in Medicare Part A, which is hospital coverage, and Part B, which is doctor's coverage, and Part D, which is prescriptions, or they're enrolled in a Medicare Advantage plan, also referred to as Part C, and is all three parts combined into one, and they are enrolled in Medicaid, this is called being dual eligible. Medicaid is the payer of last resort and works as a supplementary plan covering the 20% that Medicare does not cover. It also covers the premiums for Part B and for Part A if not eligible for free Part A. When a Medicare beneficiary has Medicaid, they are automatically enrolled in Extra Help, which can pay for a lower or no monthly Part D premium and may lower the cost of prescription drugs. I mentioned the resource limit before for Medicaid. Resources include checking and savings accounts, IRAs and 401ks, stocks and bonds, cash value of life insurance policies, and other real properties such as second home and vacation properties. If a person is over the resource limit but needs Medicaid for long-term or chronic care, we advise they speak to an elder care lawyer regarding asset protection. If a person is over the resource limit but not in need of long-term or chronic care, they can enroll in a Medicare savings program. The Medicare savings programs assist individuals and couples pay their Medicare premiums, coinsurance, and deductibles. There are 4 Medicare savings programs. The first is Qualified Medicare Beneficiary, known as QIMBY, Specified Low Income Medicare Beneficiary, known as SLMB, Qualifying Individual, known as QI, and Qualified Disabled and Working Individuals. Qualified Medicare Beneficiary Program goes up to 100% of the federal poverty level. This equates to a single person being able to earn up to $1,061 per month, and a couple earning up to $1,430 a month. There is no resource limit. It pays for Part A and or Part B premiums. You can be eligible for QIMBY only or QIMBY and Medicaid. It also pays for the Medicare Part A and B coinsurance and deductibles. Specified Low Income Medicare Beneficiary Program goes up to 120% of the federal poverty level. A single person can earn up to $1,269, and a couple can earn up to $1,711. Again, there is no resource limit. This program pays for Medicare Part B premium only. A person can be eligible for SLMB only or SLMB and Medicaid with a spend down. The individual must have Part A to be eligible for the program. The Qualified Individual Program goes up to 135% of the federal poverty level. And this is a single person. For a single person, this means $1,426 per month. And for a couple, $1,923 per month. There is no resource limit. It pays for Medicare Part B only. You cannot be eligible for QI and Medicaid. And an individual must be enrolled in Part A. Qualified Disabled and Working Individuals, this program goes up to 200% of the federal poverty level. So a single person can make up to $2,102 per month, and a couple can make up to $2,840 per month. This is the only Medicare savings program that has a resource limit. For single individuals, it is $4,000. For couples, it is $6,000. This program pays for Part A premium only, not Part B. An individual must be a disabled worker under the age of 65 who lost Part A benefits because of a return to work. Income limits are 200% of the federal poverty level, but it includes earned income deductions. For example, it does not include the first $65 of earned work income. and 1/2 of the earned income remaining after subtracting the $65 is also deducted from the gross monthly earned income. So even though this program goes up to 200% of the federal poverty level, a person actually can make more money than that due to the deductions. There are added benefits of qualifying for a Medicare savings program. If an individual missed the enrollment deadline for any part of Medicare enrollment in an MSP, if an individual missed the enrollment deadline for any part of Medicare, enrollment in an MSP waives the lifetime enrollment penalties and allows enrollment into Part B year-round rather than only during the annual enrollment period. A person who's eligible for Medicare savings can also qualify for extra help for Part D to help with prescriptions. You can apply for Non MAGI Medicaid and an MSP by working with a certified application enroller from the Nassau-Suffolk Hospital Council's Medicaid Enrollment Assistance Program for the aged, blind, and disabled. During normal business hours, Monday through Friday, 9 a.m. to 5 p.m., please call 631-435-3000 and ask to be assigned to a Medicaid enroller who will call you to provide assistance by phone. After hours, call 631-656-9783 and press option 2. Leave a message and someone will return your call the next business day. Thank you very much for being here with me today. If you have additional questions or a specific case you would like to discuss, you can call me at 631-435-3000 and ask for Stacy Villagran. Or please email me at svillagr@nshc.org. Thank you very much.